Going live on YouTube. Welcome. It's another week. The madness continues. Hopefully you've all been safe. You've been taking your supplements properly. You're protecting yourself. Whether you're doing this or not, you're protecting yourself. And again, one of the issues that we talked about often that is finally coming to the surface as one of the most important ways to protect yourself is vitamin D. We know for a fact that that is one of those crucial factors for protection. In fact, we heard it over and over again from the CDC on down this weekend. But today, I'm going to spend a little time on an article that came out of Pittsburgh, University of Pittsburgh Medical Center at Children's Hospital. Now, this is an article that was done on children, but the issue can be extrapolated back to adults as well. And that's a crucial factor. So I just want to pay attention in case you are not taking your vitamin D. Now, let me just say this. This past Friday, my daughter contacted me back in Pittsburgh, took my grandson, her son, Cooper, to the pediatrician. And he's growing like crazy. He's doing extremely well. And at 2 months of age, is exceeding all the growth spurts. But thank God we have a pediatrician that's well on top of things and said, start him on vitamin D. Even though my daughter has been taking a high dose of vitamin D during the whole course of her pregnancy and continues as she's breastfeeding. And for the doctors that are out there that say there's some risk factors involved here, this is a little kid, 2 months old, 12, 13 pounds. We started him, you ready? On 1,000 IUs. We have 1,000 IU drops. We're giving him 1 drop a day. Right now, 2 months old, 1,000 IUs. And we have doctors everywhere that are saying, oh my God, 2,000 IUs is toxic. 5,000 IUs is horrible. During the course of this pandemic, I've been taking 10,000. You don't see me with any untoward effects. And I really have not seen anything in the literature. Now, there are exceptions to every rule. But I haven't seen much on the role that vitamin D, which is, in my opinion, we'll call it the universal supplement. We call it actually a hormone. That we are looking at enough vitamin D helping to control blood pressure. Now, why is that such a big issue? Because in this study, we looked at obese children. And as we know, in the course of this coronavirus, and I'm going to extrapolate 2 things together here. In the course of this coronavirus thing, obese individuals with a level of insulin resistance, prediabetes, were at the highest risk of contracting the coronavirus. Most kids didn't, but those that did were those that were obese. So with 50+% of our population here in the United States being overweight or obese, this is particularly applicable. Vitamin D may lower blood pressure in children. I'm going to say in adults as well. Now, and it's an amazing stat that yesterday, as we were preparing for another tornado day here in Atlanta, my wife was running a headache in the afternoon and broke out the blood pressure cuff. And she took her blood pressure. She was having a hard time getting a reading, but she took her blood pressure and it was okay. But I hadn't checked mine in a long, long time. And you got to understand that in the past, for many years, I was on blood pressure medications. ACEs, ARBs, calcium channel blockers, you name it, and even beta blockers. But praise God, as I've done enough natural support, I haven't needed that. Now, is vitamin D the real workhorse with me? Maybe, or is it part of the synergism together? Overweight and obese vitamin D deficient children who took a relatively high dose of vitamin D every day for 6 months had lower blood pressure and improved insulin sensitivity than their peers who took a lower dose, according to researchers at UPMC, Children's Hospital of Pittsburgh. Hallelujah. Those that took the higher dose, so you took a whole big grouping of overweight kids that went to the University of Pittsburgh Medical Center Children's Hospital out in Bloomfield. Know it well, my old stomping grounds. And they went through various tiers of vitamin D supplementation. The study did not show improvements in other markers of cardiovascular or metabolic health. No one said it would. But when you're looking at lowering insulin resistance, which could, in essence, lower weight, improved immune system functioning, and lower blood pressure in kids, extrapolate this out to adults. Dr. Rajakumar, MD, professor of pediatrics at the University of Pittsburgh School of Medicine, they enrolled 225 healthy but vitamin D deficient 10 to 18-year-olds in Pittsburgh who were overweight or obese in the clinical trial. So we got kids aged 10 to 18. This is why I think this can be extrapolated to adults. Now, they did their blood work, and they found out that they were vitamin D deficient. Now, that test, in case you don't know, is 25-OHD. So I ask you right off the bat, do you know your vitamin D levels? Do you know your children's vitamin D levels? Do you know that your overweight 18-year-old could be hypertensive right now, could be pre-diabetic right now? And as a parent, ask your pediatrician to do the blood work. When they do the blood work, ask them to do your vitamin D levels. And if they won't do it, seek elsewhere and we can help you with that. Out of that 225, 211 were African American. A press release on the topic notes that people with darker skin have more melanin pigment, which acts as a natural sunscreen and inhibits vitamin D production. So, by essence, nearly 80% of African Americans are vitamin D deficient. So 80% of this study happened to be, and again, where this hospital is located is primarily an African American community. So this is where we recruited the most overweight and vitamin D deficient children. So again, this isn't just segmenting on the African American population. They probably tested 2,000 or 3,000 kids, but they picked those that were severely vitamin D deficient. So this article goes on to say, a press release on the topic notes that people with darker skin do have more deficient vitamin D. The children were split into three groups. So we got 225, three groups. One group received 600 IUs, which is, again, my daughter's pediatrician started my grandson on polyvisol, which has 400 IUs in it. And most pediatricians will say, oh my God, that's more than enough for a child. 601 group. One group received 1,000. That's where I had my grandson. And one group received 2,000, which I think is even still low. The study was double-blind and ran for 6 months. By the conclusion of the trial, none of the groups was considered vitamin D deficient. So no matter if they were on 600, 1,000, or 2,000, it brought their vitamin D level up into what was considered somewhat normal. Now, that normal range runs from 35 to 110. By the conclusion of the trial, none of the groups were considered vitamin D deficient. After 6 months, the children receiving the 1,000 IUs had lower blood pressure, and those receiving 2,000 IUs had reduced fasting blood glucose levels and improved insulin sensitivity. There were no significant changes in measures of the health of the membrane that lines the blood vessels or on arterial stiffness, both of which are strong indicators of heart health and were the primary measures of the researchers were seeking to influence. So they were seeking to look for something else. Arterial stiffness. Now, you add the proper dose of fish oil to these kids and clean up their diets, arterial stiffness will go down dramatically. Or maybe pycnogenol, French maritime pine bark. Dr. Rajmukar said in the release, there are many reasons we might not have seen changes in endothelial function or arterial stiffness. Maybe vitamin D simply doesn't affect these. Or perhaps we didn't reach, or maintain a level of vitamin D to cause an effect. Could going up to a higher level. See, we don't know what those results were. We don't know, did they just nudge them into the low 30s? But if we took them up for 6 months and got their vitamin D level up into the 70s, would there be a difference? Probably. It would also could be that our trial didn't run long enough. However, treatment of vitamin D deficiency with these higher daily doses can have a positive impact on cardiometabolic health of the children. Cheers. Now, what about eggs? Notice I'm not going into coronavirus right now, because I think it's amazing what's gone on over this past weekend, that more and more things are coming out that this was not from those fish markets in Wuhan. That it looks like more and more that it's coming from a lab. More and more that it was a lab we knew about. And it was one doing research over there. One that we actually paid to help. What was that research about? Who knows? Maybe making vaccines? Who knows? But whatever it is, the research has gone haywire. Study finds no harm in egg consumption. Hamilton, Ontario, team of researchers from the Population Health Research Institute of McMaster's University looked at 3 large, long-term multinational studies and determined there is no harm in consuming eggs. Moderate egg intake, which is about 1 egg per day in most people, does not increase the risk of cardiovascular disease or mortality, even if the people have a history of cardiovascular disease or diabetes. Oh my God. This is Dr. Mashid Degnan, first author. The researchers analyzed egg consumption of 147,000 individuals from 21 countries and 32,000 patients with vascular disease, according to the release. No, none, nada, none association was found between egg intake and blood cholesterol. There was no relationship between egg intake and blood cholesterol. Let me say that a third time, doctors. There was no, none, nada, intake, raising of cholesterol levels from egg consumption or any other risk factors. The results are robust and widely applicable to both healthy individuals and those with vascular disease. This study was found in the American Journal of Clinical Nutrition, Hamilton, Ontario. In case your doctor says, oh my God, your cholesterol's up, you better watch your egg intake. Wrong. We're going to file this under eggs because that file continues to go up. Just a couple more is that on Wednesday's show, we're going to talk about a study that was started a while ago on fish oil. Synthetic fish oil. Because medicine thinks they can do it better than the way God did it. And we'll have some interesting things that come out of there. Now, in the news today, I'll just finish with this today. A look at some of the latest research on the novel coronavirus disease that came out of the New England Journal of Medicine this morning, hydroxychloroquine and hypoxic pneumonia. Researchers in France examined the medical records of 84 patients with COVID-19 requiring oxygen who received hydroxychloroquine and 97 similar patients who did not get the drug. Primary outcome, transfer to the ICU or death from any cause within 7 days did not differ significantly between the groups. The researcher says the findings do not support the use of hydroxychloroquine in patients hospitalized for the documented SARS-CoV-2 pneumonia. Bacterial. Headlines. COVID-2, hydroxychloroquine, and hypoxic pneumonia. You would believe, by hearing this, and I heard it on the news this morning, that this study out of France came out and said, and no, it's not working. There was no difference in the groups. We're talking about those that had a secondary problem, pneumonia, those who probably were on a PPI for acid blockade, which made them more susceptible to secondary pneumonia, or they weren't properly intubated with a respirator and developed pneumonia, or they didn't have sufficient vitamin D levels and developed pneumonia, or weren't doing anything proactively and developed pneumonia. Study appears in the New England Journal of Medicine. Reporting in Nature Medicine, researchers in China examined viral loads on some 90 COVID-19 patients, as well as data on the timing of transmission among nearly 80 transmission pairs. That is, one person likely infected the other. Combining these data, assuming an incubation period of 5.2 days, the researchers conclude infectiousness began 2.3 days before symptoms onset and peaked 0.7 days before symptoms began. They also estimate that pre-symptomatic transmission accounted for 44% of the secondary cases among transmission pairs. Pre-symptom. So again, they've said over and over again, those that had no symptoms were the greatest risk of transmission. In this case, 44%. Story number 3. In a sample of 1,200 patients with respiratory symptoms in California, 21% of the nasopharyngeal swab specimens that tested positive also tested positive for other respiratory pathogens like rhinovirus, the common cold, enterovirus, colon issues, and respiratory syncytial virus. In addition, of those that tested positive for non-SARS pathogens, 8% had tested positive for SARS coronavirus 2. Writing in JAMA, the researchers conclude the presence of non-SARS-CoV-2 pathogens may not provide reassurance that the patient does not have coronavirus. Decontamination of N95 masks. A study on decontamination strategy for disposable masks reported on the preprint server found that 70% alcohol, rubbing alcohol, and ultraviolet light each significantly degraded mask integrity. It actually took apart the mesh within the mask itself. So cleaning these things using rubbing alcohol or using any of those topical alcohol preps didn't work. Vaporized hydrogen peroxide, meanwhile, did not significantly change mask integrity after 2 treatments. In addition, the investigators applied virus to the mask, and virus was still detected after decontamination with vaporized hydrogen peroxide and ultraviolet. The bottom line is throw the masks away. The authors of an opinion piece in the Annals of Internal Medicine urged caution in using the Institutes for Health Metrics and Evaluations model for predicting the trajectory of COVID-19 pandemic. They point out potential flaws with this model, including use of unreliable mortality data. All the things we heard in the news, now they're saying it didn't really work. And lastly, again, the possibility that seasonal flu shots are potential contributors to the current outbreak. British Medical Journal, February 28th, a randomized placebo-controlled trial of children showed that flu shots increased 5-fold the risk of acute respiratory infections caused by a group of non-influenza viruses, including coronavirus. I will fight to my dying day that there are better ways than a flu shot. If you want to reach us here with any questions you might have, 678-228-8900, 678-228-8900. Like our YouTube page, please. Share it with others. And we will talk to you soon. The website is thenutritionshop.net. God bless you, folks. We'll see you back here real soon. Take care.